India is home to a third of the world's blind population. Given proper medical care, many of them could have their eyesight restored. But the country simply can't provide the resources. I'm Fawzia Ibrahim. On this edition of 101 East, we look at the extraordinary efforts of one man trying to give the gift of sight to India's blind community.
Morning over Madurai. A new day in this ancient temple city at the southern tip of India. The sun has barely been up an hour, but at Aravind Eye Hospital, the workday is well underway. As nurses load a bus with boxes of medical equipment and supplies, patients are already lining up in the hospital's waiting rooms all along this busy downtown street. The care these people will receive today is as good as you can get anywhere in the world. Arvin surgeons are just as skilled, their tools and technology just as modern. The only difference is that most of these patients won't pay for their care. It's free.
So Arvin started with this mission to eliminate needless blindness by providing high-quality, high-volume, compassionate eye care to all.
Ending needless blindness, no matter how poor the patient, may sound like mission impossible. But that was the extraordinary vision of an extraordinary man, Dr. Govinda Venkataswamy, known as Dr. V. He founded Arvin more than 30 years ago and served as its guiding light until his death in 2006. Where this building now stands, Dr. V opened a tiny clinic with just 11 beds back in 1976. Since then, Arvind has grown into the largest eye care provider on the planet. With more than 4,000 beds in its hospitals and clinics across southern India, Arvind's annual statistics are staggering.
We see about 3 million outpatients and roughly perform about 300,000 eye surgeries and laser procedures.
How Aravind has been able to make its remarkable journey from 11 beds to a medical miracle serving millions is what I'm here to see. Some of Arvind's most important work actually happens outside the hospital walls. So I tag along with the team on the Arvin bus, heading out of Madurai. It's not entirely understood why India suffers a high incidence of blindness, especially here in the south. It could be genetic, possibly poor nutrition, or it could be the long hours so many people spend in the hot, bright sun. We're on our way to set up what's called an eye camp. It's a free walk-in clinic in a rural area. Arvin does hundreds of camps every year. After about an hour and a half, we're on a dirt road that dead ends at our destination. It's a one-building women's college surrounded by a sea of farm fields.
With the camp, we can reach all places, rural most places where patients, they won't be able to travel much.
The nurses unload and in a matter of minutes transform the classrooms and cafeteria into examination and waiting rooms. By 10 o'clock, everything is ready, just in time, according to Dr. Raghuram Venkatesan, doctor staffing this camp. He says patients will take a break from work to get their eyes examined.
They'll start working at early 5 a.m. till 10, 11 they'll be working. So whenever the set of batch, the work is done, they'll be coming as a group, 5 to 10 or like that. So we would expect around 150 today. Since it's a new camp, we could expect only that much. In a new camp, you can expect the crowd to be less.
150 people is small compared to other camps that Arvind has set up in the same place year after year. Those camps often draw more than 1,000 people.
In a well-established camp, as soon as we enter, we'll be having hundreds of patients waiting, and there'll be so much knowledge. They know the whole system, they'll be cooperate so much.
But today, at this new camp, it's more of a trickle as patients start arriving. The people who come to the camps are poor, some so poor they can't even afford to take the bus here. They walk, sometimes for hours. Meanwhile, back in Madurai, patients have been streaming through the corridors and exam rooms since early morning. Each day, all Arvin's hospitals combined will see about 6,000 patients and do almost 1,000 surgeries. But even that is just a fraction of what's required.
So there's a huge need for the services that we're providing. In India, 20 million need some sort of eye care. And only 10% of them have been reached so far, even with so many organizations.
As operations manager, Deepa Krishnan explains to me in a brisk presentation, that massive gap between demand and supply is what fuels Aravin's relentless drive to increase productivity.
80% of the blindness is preventable or curable, and a simple procedure like a cataract surgery can give sight to 7.5 million people. So that means that we really have to constantly be thinking of what sort of innovations can help us meet the mission.
That means no step in the process of treating patients is too small to be analyzed and put to maximum use.
You can see just how busy this intake area is, and to help manage the flow, Arvin has even this down to a science. This calendar is based on the last 3 years of walk-in patient data. So for every single day, they know exactly how many patients to expect.
Arvin's chairman, Dr. R.D. Ravindran, still spends several days a week in the OR. He says not only has Arvin invested in the best surgical technology, but also in technology outside the operating room to help doctors keep patients moving.
You must have seen all those the monitors in the doctors' cubicles. So we also want them to be aware what is happening, how many patients are waiting outside, and how many patients have been seen. When the patient walks in, he should be seen within 90 minutes. So that is our benchmark. So we would like to see how many patients are seen. If that information reaches the doctor who's inside a cubicle, he is not seeing what is happening outside. That motivates them to do a better job.
One of today's patients is K.R. Umashankar. He's a businessman who's here to have cataract surgery.
Difficulty seeing.
He told me he decided to come in when he started having trouble seeing his computer screen.
And you can't do that now.
I have double vision due to the cataract, and I can't see long distances, so I cannot drive either.
He's examined and prepped, like so many others who will pass through Aravin's busy operating rooms today. These are patients who can afford to pay, and here's how it all works. A super efficient approach means Arvin makes enough profit from its paying patients to fund free or heavily reduced rates for the poor. About 1/3 pay Arvin's full price, which is already lower than market rates, and the rest pay little or nothing at all.
Yeah, we have maximized the productivity of both the doctors, nurses, and also the equipment. So that brings down the fixed cost on any procedure, on any treatment. So at least we have 6 nurses to support 1 doctor, which means that 1 doctor is able to do about 8 to 10 surgeries per hour.
With around 2,000 operations per year, Aravind surgeons are among the most productive in the world. By comparison, American eye surgeons do about 125. Cataract removal is a delicate but fairly simple procedure. I watch as a small incision is made, instruments inserted, the clouded lens gently pulled out, and a clear new lens slipped into place, all in less than 10 minutes. As soon as one patient is finished, the surgeon simply swivels around to the next, who's been prepped and slid into place, back and forth, over and over, for hours. Setting up an assembly line to do millions of surgeries is the brainchild of Dr. V, Arvin's founder. Dr. Ravindran says Dr. V was actually inspired by how McDonald's makes billions of the same cheeseburger.
He had been to America several times and is always fascinated by the McDonald's being the same in different places. So he felt that if the same logic, the principle can be brought to eye care, and if you're able to standardize all the procedure, processes, the way it is operated, the way we set up an eye clinic, the operating room, he felt that we will be able to take care of the blindness.
To do that, Arvin grows. In much the same way a fast food franchise opens a new restaurant.
Recently, we opened 3 new secondary care hospitals. And then the next 3 or 4 months, we'll be opening 2 more hospitals.
Show me again where the hospitals are.
Here, Madurai is a main hospital. And then we have Theni.
All told, Arvin now operates more than 50 clinics and hospitals in southern India.
Hospital here in Salem.
Is there any thought to expanding outside of Tamil Nadu?
We
Eventually?
we are proposing. We are hoping that we'll be able to start in other adjacent states.
Right.
But we are supporting close to 300 eye hospitals all over India, in Africa, South America, and also in Southeast Asia.
But Arvin's growth and push for efficiency haven't hurt quality. Arvin hospitals have fewer complications than many Western hospitals. That reputation for high quality is what continues to attract the paying patients, like Mr. Umashankar, who said he trusted Arvin after his father's successful cataract surgery years ago. It's the paying patients and the Arvin system that make it possible to carry out the mission of providing compassionate, affordable eye care to all who need it. Like the people out at the eye camp, all of whom are poor. Dr. Raghuram Venkatesan says that sometimes people are suspicious, and he has to convince them that Arvin really will fix their vision for free.
They will want to know whether it's 100% free. That's the main thing they will know. And they will want to know whether when they'll come back. Many are from farmers. They want to know how many days they need to stay home post-operatively. So
They're worried about getting back to work.
Yeah, all those things. They are mainly going for daily wages. If they give work today, they'll get the money. So they want to know all those things.
Some problems can be solved at the camp with medication or glasses. Others are more serious.
I can't see faces clearly in the distance, and I am finding it difficult to see what I am cooking. I am not able to see clearly.
Pandima, a mother of 2, has a cataract. It's the most common cause of blindness in India, and until quite recently, a source of despair.
Many will feel once if they get cataract, that's it. They don't have any other hope.
Pandima says her vision has been growing dimmer every day, but she knew she still had some time, and she wanted to wait for this camp.
Since my children are studying and have exams, I thought let them finish their studies, and then during the holidays I could take care of this. Then they started this camp here. The watchman who is working here comes from my village, and he also told me about this camp, so I wanted to give it a try.
The fact that Pandima didn't wait until she'd completely lost her vision before seeking treatment is a good sign. Arvin's chairman says it indicates that even Indians in rural areas who might rarely see a doctor and might be afraid they can't afford care are learning that Arvin can help before it's too late.
Earlier, only when the people became blind, they used to come for surgery. But today, the minute they become disabled due to cataract, they all would like to have surgery.
Pandima and the others who need surgery, about 24 in all, may be better informed, but that doesn't mean they don't need some reassurance about what they're about to go through. Most have probably never been to a hospital before.
They will expect few kind words like, don't worry, everything will be fine. It's a matter of time. When your cataract is removed, you will get the vision back.
By late afternoon, Pandima and the other patients are on their way back to Madurai on the Arvin bus. They check into what's called the camp hospital, where they settle in for the night. Even if the overnight accommodations are Spartan, the care they'll get in the morning is as good as money can buy.
The service part is equal. The comfort part will be differentiated, just like you go in economy class or in a business class. Surgeons are same, technique is same, products are same, site is same. But how do you get that site? And the patients are also not very particular that they have to have a separate room. They know very well they are not paying anything. So they're very happy.
Dr. G. Nachiar is the late Dr. V's younger sister. When he opened the clinic back in 1976, he enlisted his family, a family full of doctors, to help him build a different kind of family business. Money was scarce and times were tough.
Did you ever think that we can't make it? That we're not going to.
I always thought that much. I always thought that's a truth.
In the early years, she says the family was not convinced that Dr. V's vision could ever become reality. But the family stood by him.
We wanted to support him, not the vision. So whatever he wanted us to do, we did it. Then we became addicted to the rewards, addicted to patient satisfaction, addicted to the volume of patients who are coming in searching of us, addicted to our service. All those rewards, we also became part of it. So to start with, he was the only one who had a vision.
On top of overcoming their own doubts, they had to overcome their patients' doubts as well.
They didn't trust us. Normally, they think when you give any charity, the quality is being compromised, which is not true, but sometimes they think. Or when you talk about volume, there is no quality. But we had a very unique model where we have a high volume, high quality, affordable cost for few, and totally free for most of the people.
To me, I look at it as an organization that has to respond to the needs of the community. So I don't look at it as a business model, but Aravind has been an organization right from the beginning, responding to what the community needs.
Business, charity, community organization, whatever it is, Aravind is thriving. Started by 5 family members, today it employs more than 3,000 people, and it's been studied at Harvard Business School.
Whatever we've learned, the models that we've built, the best practices that we've developed, all of it is, it's our mission to give it away to other hospitals to use.
It's a long way from where they started, when Dr. V had to use his home and his sister's jewelry to help secure a small bank loan, a process they all found humiliating.
We lost our sort of pride and dignity. That experience was not very pleasant. But today, hundreds of banks people are so proud, they said they would like to fund us. But that time when we wanted to start, there was no single soul to help us.
That means Aravind has had to learn how to be self-reliant.
All of our growth has been internally funded. That's what we do with our surplus. Because it's a non-profit, the money doesn't go to any individuals. It's put into a fund. So that fund is what drives our growth. And that fund is what also helped us start Aurolab.
This is Aurolab, Arvin's own lens factory, and maybe the strongest testament to Arvin's self-reliance and growth. I got a tour of this state-of-the-art facility, first launched in the early 90s when Aravind had hit a wall. It couldn't afford to continue to expand the number of free and subsidized surgeries because the cost of a replacement lens had gotten too high, about $100. But by cutting out the middleman and other expenses, Aurolab is able to sell them for a fraction of that, about $2, and still make money.
So when Arvin built this place, the idea was just to serve their own needs, but what they ended up doing was changing the global marketplace.
So our mission is not just eliminating needless blindness in our service area, but across the whole India and also in the whole world.
Aurolab not only supplies the Arvin hospitals, it accounts for nearly 8% of the global lens market, exporting lenses and other medical products to 130 countries, mostly in the developing world. Like the rest of Arvin, Aurolab is part of a non-profit trust.
So our philosophy is not to dominate, but to create a movement towards better care, lower costs, and more financial sustainability.
That focus on sustainability is what ensures that the kind of free care given to Pandima, the patient I met at the camp, will remain available for years to come. She tells me she's a bit nervous, but looking forward to her surgery. She's then prepped and escorted into the operating room. Almost every step of the way, Arvin patients are accompanied by young women workers. From the waiting room, through the exams, to the recovery rooms. This rainbow army, Arvin calls them MLOPs for mid-level ophthalmic professionals, is color-coded by duty. They're trained on the Arvin campus, and they live here in a communal dorm. Drawn from local villages, they're a familiar and reassuring presence.
Most of the patients who come here are from the villages, and so only village girls like us know and can understand very well what they want and need.
They are like the pillars of Aravind. The children who come from the agricultural families, they know what hard work is. They don't mind working hard. All of us work hard. It may be like 8-9 hours of work, like any other place, but here it is every minute. There is no kind of time for you to relax.
But it's not as if staying in the village is easy. For young women, village life usually means early marriage and childbearing, and little or no chance to pursue education, much less a career.
Because I'm working here, things are different. In the village, they'd have waited until I was 20, and then tell me it's time to get married and settle.
The salaries many of these women earn at Arvin help support their families back in the village or fund additional education. Further evidence of Arvin's impact not only on its patients, but on the larger community.
The girls, probably they are the first people to step out of their village also for that family. And the year after year when they go back, the parents, they see the difference in that girl. So that people see that difference, and that is what also makes other girls in that same community come to us. They bring them actually.
Aravin's influence goes beyond the medical and cultural. It's even making its mark on Madurai's economy.
Not only has Arvin changed lives, it's actually also transformed this city. Once known primarily for its temples, Madurai has become something of a mecca for eye care. We're just down the street from the Arvin Hospital here, and everywhere you look, optical shops.
In some ways, everywhere you look in Madurai, you are looking into the eyes of Aravind. The woman making garlands on the corner, the accountant at the wedding hall, the laborer in the metal shop, all of them, and so many others, people who owe their vision to the vision of Dr. V.
The gratitude to get from the patient, when the patient leaves or sees you again, thank you, all that makes it's a very special place.
I would say it's more like a passion. I would love to work in this institute as long as I can. Post-operative, you'll be hundreds of patients with the smile that they have lost for more than years. Like waking from a sleep for them, a long sleep. They'll feel a lot more happier.
People open their eyes and then they say, thank you, doctor, and that's nothing can be compared with it.
And that's all the time we have for this edition of 101 East. You can always follow the program through our website, podcast, Facebook, and Twitter. From all the team, thanks for watching.